Thank you very much, Presiding Officer. The success of Scotland and the UK's vaccination scheme means we can now look to move forward and remove almost all COVID restrictions. In advance of today's statement, my party called for the easing of restrictions to happen as planned. We highlighted the need for rules on social distancing to be removed so that businesses can get back to normal trading. We sought changes to the self-isolation rules for those who've been double vaccinated and a move towards a test-first system instead of a blanket requirement to self-isolate for 10 days. And we've argued for some time for changes to self-isolation for children in schools, prevent their learning experience from being disrupted further. For the same reason, we wanted to see the requirement for face masks in schools be removed. We proposed these steps because the vaccine is working. It is saving lives and limiting the spread of the virus. And that's why I would urge everybody to go out and get it. We're pleased the government have listened to our suggestions. However, overall, today's statement is a mixed bag. It takes some welcome steps in the right direction, but these ongoing restrictions will hold Scotland's recovery back. When Scotland moved to level 0, some people were rightly confused because level 0 implies no restrictions, yet many restraints remained in place. We've now moved beyond level 0. Again, people would rightly assume this means that COVID restrictions have been dropped, but still curbs remain in place. Yet again, the goalposts have been moved. We're beyond level 0, at level -1 or level -2, and still the government is clinging on to large parts of people's lives. Events still have capacity constraints. The threat of local lockdowns and travel bans remain. The government seems to be U-turning on COVID status certification, home working is still being enforced, and social distancing is in a very grey area, where the legal restriction is gone, but the guidance remains in force. Clear communication is essential to maintaining public trust and compliance. There isn't much clear on many fronts in this statement. People have gone through a lot. They've sacrificed and tolerated severe constraints on their lives. They've done this with impressive dedication because it was necessary and the public health data supported those decisions. But they're losing patience with these last-minute extensions and limitations on their lives without full justification or a clear idea of what comes next. So can I ask the First Minister, are you seriously considering in the future imposing another local lockdown or introducing a travel ban where people can't leave their local area? And if so, how will that be enforced? When will the limbo on social distancing end so that all the barriers are removed? And finally, can I ask the First Minister, given the scale of Scotland's drug death crisis and the heartbreaking loss of life, even at this late hour, will she finally step up and lead her government's response this afternoon?
First Minister.
On that last point, Angela Constance, the Minister for Drugs Policy, is standing ready to make a statement on Scotland's drugs death statistics as soon as I have finished making this statement. Angela was appointed by me, as all ministers are, and she reports directly to me, and I will continue to make sure that this government addresses that challenge and takes the action necessary, and Angela will set out more on that later. Listening to Douglas Ross there, I was struggling to understand whether or not he'd listened to the same statement that I delivered to the Chamber. I spent every single day since March last year trying to deliver clear communication. I am sure I have not always succeeded. I readily concede that. Sometimes it feels as if Douglas Ross and his colleagues have spent many of these days trying to undermine the clear communication, and I got a whiff of that again today. So let me try to take him through it again. Firstly, Douglas Ross is right. The Tories have called for most of the changes I have announced today. The difference is they called for these changes to be made at a time when it would not have been safe to do so. It would have put people more at risk, and that is why we have continued to take a safe, cautious and steady pace through our exit from lockdown. I think that's right and proper, and I will continue to do that, whatever brickbats I get as a result, because as First Minister, the fundamental duty I have is to act in a way that keeps the country as safe as I possibly can. Douglas Ross called it a mixed bag of a statement. I call it sensible and cautious. It will keep people as safe as possible, and frankly, keeping the virus under control, keeping people as safe as possible, is the best thing this government can do for our economic recovery as well. Most, with the exception of face coverings, most of the legal restrictions will be lifted from Monday. That's exactly what we said would happen. I don't know that many people, maybe Douglas Ross is one of them, who think that continuing to wear a face covering while this virus continues to circulate is a significant hardship. Most people I speak to, most people who contact me, not everybody obviously, but most people think that is a reasonable price to pay, not so much to keep ourselves safe, but to keep others safe, and therefore hope that others will do likewise to keep us safe. And that is part of the collective solidarity that I think most of us feel as we get through this virus. And Douglas Ross said to me, am I seriously suggesting that in the future I might impose local restrictions or travel restrictions? Well, let me say this very clearly to Douglas Ross. I fervently hope that will not be necessary. I really, really do. And I know that if we all continue to exercise the care and caution that everybody has exercised for the last year and a half, then we will minimise the risk of that being necessary. But as First Minister, and no more so than over this last year and a half, every single day, and I'm sure every leader of every government in the world will say this right now, the responsibility weighs heavily on my shoulders to keep people safe. So in direct answer to the question, if I thought action like that was necessary to restrict and curb an outbreak or spread of this virus, or perhaps a new variant of this virus that would put lives at risk and our National Health Service at risk, then no matter how difficult that would be, no matter how unpopular that might be, I would take that decision, because that's what I am elected to do, to take the tough decisions to keep people safe. And if Douglas Ross doesn't understand that, then perhaps this is not a position he should ever want to be in, because you have to be prepared to take those decisions, however much you hope these decisions will not be necessary. So this has been a cautious, sometimes too cautious for some people, careful, steady route through this. Monday is a significant, perhaps the most significant date so far, and it is positive. But I will not shy away from saying to people, I'm not going to shout freedom in this respect in any event. I'm not going to shout freedom from this virus, because I think it misleads people. The virus is circulating. The risk of new variants is there. So it is no longer proportionate to, in every respect, have legal restrictions in place, and the government has to act lawfully. But yes, of course, we will continue to advise people to be sensible, to be cautious, to follow routine mitigations that minimise that risk. And anybody who thinks that is wrong, I don't think is acting responsibly. And I will continue to try to do my duty as First Minister to the very best of my ability.
I call Anna Sarwar.
Thank you, Presiding Officer. And can I start off by saying thank you to all of those that continue to work on our front line, particularly in our NHS, and to thank our vaccinators across the country who have got us to the point that we've got to today. They genuinely are heroes. And I think it's also important to recognise that people are still dying of this virus. And so my thoughts and condolences go out to all those that have lost a loved one in the last 24 hours or at any point throughout this pandemic. As the First Minister has outlined, we are now at a crucial moment in our exit from restrictions. And I want to pay tribute to our citizens across the country for the huge sacrifices they have made over the last year and a half to get us to where we are today. There is definitely light at the end of the tunnel. However, we're also at a crucial point for Scotland's recovery. It's good to see the positive improvements in the rate of cases and numbers in hospital. That is welcome. And as restrictions continue to ease, we need to ensure that people are being kept safe. That means recognising that a new period in our fight against the pandemic needs a new approach. As we move beyond level 0, it is important that we do everything to protect the freedom that people can now enjoy again. It means retooling our vaccination effort to target those places where it lags and preparing it for the next big challenge. The last few weeks have also underlined the importance of test and protect. And if increased testing is the alternative to self-isolation, then we cannot allow the resourcing of the testing and tracing system to again be neglected. But we all know how key vaccination is. We must maintain the progress and intensity of the programme. In recent weeks, the 7-day rate of vaccinations has reduced, and there are still thousands of young people awaiting their first dose, never mind their second dose. And we should be doing all we can to remove barriers to vaccination and encourage uptake. So can I ask the First Minister what plans there are to make vaccinations more accessible for those in need of a dose? For the hardest to reach, we need to take vaccination centres to the people, not people to the vaccination centres. So will we see pop-up clinics at sporting events, universities, colleges, train stations, and when will that commence? In low uptake areas, will she consider looking at door-to-door vaccinations to ensure that we increase uptake in those postcodes? I also want to ask about ongoing support for Scotland's businesses and employers. Today's news will be welcome for many businesses, including nightclubs, that have been closed now for up to 18 months. But these businesses will not bounce back immediately. So how will the Scottish Government ensure that livelihoods are protected and Scottish businesses can continue to have confidence in their recovery? There are also now recommendations for some clinically vulnerable school-age young people to get the vaccine and a booster programme in the autumn. There is also the hope that eligibility will be extended more widely for young people. So what guarantee can the First Minister provide that all eligible 12 to 17-year-olds will receive their first dose before the return to school in less than 2 weeks? I think there does seem to be a slip in target outlined today. And what preparation work is now being done if we do get further eligibility for 12 to 17-year-olds? And finally, for booster and flu vaccine, when will individuals most at risk receive details of how the autumn booster programme will run? The JCVI interim advice suggests that should start in September. Is that looking like a reality, and will details be shared with Parliament? These questions are not just essential for keeping individuals safe, but also protecting our NHS into the winter. After so much restriction, it is only right that we move heaven and earth to protect our return to some level of normality. And again, can I thank everyone across our country for the huge sacrifices they have made and they continue to make in the face of this pandemic.
First Minister.
Thank you. These are all perfectly reasonable questions. I'll try to go through them all. I think I've noted them all down. If I miss any of the points of detail, I'll either return to them later or right afterwards. Most of them are about vaccinations, so I'll spend most of my response on that issue. I think the only thing I would take issue with in Anna Sarwar's questioning is perhaps a turn of phrase which I don't think is a reasonable one, where some young people were described as still awaiting a first dose. All over 18s have been offered a first dose. Some have not taken up that offer, but awaiting makes it sound as if they haven't been offered it. We are still and will continue to work to get uptake rates as high as possible. Uptake rates are high, higher than perhaps I might have anticipated in the younger age groups, but not as high as we want them to be. Overall, our vaccination programme is going extremely well. I think in terms of percentage of the total population, we are certainly above England and Northern Ireland on first and possibly now on second doses as well, but all 4 nations are doing well in this. But our vaccination programme is a success, and I think everybody should recognise that, because it is down to the hard work of those that Anna Sarwar rightly pays tribute to. In terms of the first question, will we have more pop-up vaccination clinics or sites? Yes is the answer to that. We're looking at all possible ways to access young people where young people are, as opposed to expecting young people to go to clinics. Now, we can't get everywhere that young people spend their time. I had a conversation this morning about, and this is just a conversation at the moment, it's not necessarily something that will definitely happen, but talking to the nighttime industry about, as nightclubs open, whether there are ways there of using that to extend vaccination to young people. So, you know, sporting sites, places that young people go to regularly, these are all places that we're looking to get promotion of vaccine into, and where possible and practical, to actually get vaccination to or near as well. I have perhaps more scepticism, although I would never rule anything out, about door-to-door. just in terms of the labour-intensive nature of that, given that the vast majority of eligible people are vaccinated. So you would be going to a lot of effort and going to a lot of doors where everybody was vaccinated. So I've got a scepticism about whether that is the best way to go. But we, of course, don't rule anything out. We want to get to as many people as possible. On the JCVI points, yes, we are trying to get to eligible 12 to 17-year-olds as far as possible before schools go back. I said building in a bit of understandable flexibility there, given the nature of this group, that we will certainly be offering first doses by the end of August, but we want to do that as quickly as possible between now and school return. Of course, not all schools go back on the same day. Some of them go back further into August than others. As I said in my statement, we are hoping to get updated advice from the JCVI over the next day or so. I hope JCVI are our advisory body, so they have to give us the advice they think is right, and I respect that. I am hoping it will recommend going further on the vaccination of young people. I am particularly concerned, if possible, to get vaccination to 16 and 17-year-olds, which is obviously important for those who will be, for example, going to college and university and mingling with older young people who are vaccinated. But we'll see what that advice brings, but we stand ready to implement that as quickly as possible. And we wait the final position on booster vaccinations. My expectation is that there will be some form of booster programme. We're just assuming that in order to get the preparations underway, and would look to notify people as we go through the next few weeks and certainly into September. And finally, I think on businesses, the most important thing we can do for businesses is not just get them open again, and as of Monday there will be no business legally required to close under COVID regulations, but also to build the confidence of their customers to start using their services again. And that is also one of the reasons why a cautious and careful approach is required, because if people don't feel safe in venues, they will be less likely to go. And we'll be working with businesses to encourage businesses to think very carefully about the environment that they're offering for their customers as well. We will continue to consider financial support for as long as necessary, but of course we want to get businesses trading and making money again, because we don't have infinite sums of money to spend on business support. And the last thing I would again encourage the UK government to do is extend furlough for longer, so that we're not cutting that support to businesses earlier than is, I think, appropriate for many. So I think I've covered most of those points, but if there are others that I've missed, I will come back to them later.
Thank you. I call Patrick Harvie.
Thank you, Presiding Officer. The First Minister, as well as Douglas Ross and Anna Sarwar, have all recognised the importance of the vaccination programme. Everybody, I think, recognises that the people who developed it and delivered it are due our immense gratitude. It has saved lives and is continuing to do so. But I think it's also recognised that vaccination is not a cure-all. It doesn't eliminate all risk. It doesn't prevent everybody from being exposed to this virus, or from the risk of becoming extremely seriously ill or having their life put at risk. So I'm concerned that there is still a great deal of emphasis on this idea of COVID status certificates, so-called vaccine passports, particularly as the First Minister refers to them in relation to higher risk venues. It raises human rights implications if our ability to live our lives is dependent on our health status. It raises inequality issues if the workers in those higher risk venues are not themselves fully protected. And ultimately, can the First Minister agree, is it not the case that only direct mitigation measures to make those higher risk venues less risky is actually going to give us the protection that we need? Status certificates will not achieve that.
First Minister.
Again, I think these are perfectly reasonable questions, and I've got a lot of sympathy with all of them. Firstly, Patrick Harvie is right to say that vaccines, although hugely effective and the programme is hugely successful, do not eliminate all risk and all harm from the virus, and we have never said that vaccination does that. What we do know, and I think we now have lots of evidence of this, is that they significantly weaken the link between somebody getting COVID and becoming seriously ill from COVID. Don't eliminate that risk, particularly if somebody might have other underlying health conditions, but they have weakened that, and we can see that in the still concerning but much lower level of hospital cases in this wave than we've had in previous waves. There is less certainty about the impact on transmission of the virus, but we hope it has a positive effect there. Vaccination, I don't think we can overstate the importance of vaccination and where we are now and where we hope to continue in the future, but we have to be realistic and frank about all of these things. We have to recognise the limitations as well as celebrate the enormous success. Patrick Harvie said I put a lot of emphasis on COVID status certification. If that's how it sounded, I want to try to redress that. I wasn't seeking to emphasise it or somehow pull it out as being the big next thing that we're definitely going to do. I wanted to be frank with Parliament that we are keeping our options open. So in the app we're developing, I think it's important to be frank with Parliament that there will be functionality that we are not immediately planning to use, but there will be functionality that we could use in future if we decided to do this for domestic certification, because the principal objective of the app is to make access to certificates easier for international travel. That does not mean we have taken any decisions. I am highly cautious about COVID passports, to give them the colloquial term, for all the reasons that Patrick Harvie has set out. I would be fundamentally opposed, passionately and fundamentally opposed to their use for access to public services or anything that was seen as something essential for people to access. I don't think they are a replacement for sensible mitigations, and I agree with that point. But I think there is a debate to be had about whether in some venues that are optional in terms of people's attendance at them, and where we know there is a higher risk of transmission, that we at least think about whether they could play some part in making these settings safer than they might otherwise be. There would have to be agreed exemptions in place, because there are people, as we know, who cannot get vaccinated. So I'm simply not ruling this out, because I don't think it would be responsible to do it. But I think people can hear, if they didn't hear it in my original statement, I think they can hear it now. I am far from convinced that it is a road we should go down. But I don't want to close off Parliament's options, or the government's options, or the country's options. But I do give an undertaking that we will continue not just to update Parliament, but to consult and involve Parliament as our thinking on this, or if our thinking on this develops to the point where we were proposing the introduction of COVID certification for any particular setting.
I call Liam McArthur to be followed by Alistair Allen.
Thank you, Presiding Officer. Only a few short weeks ago, Scotland had record numbers of daily cases, amongst the highest in Europe, and testing for Trect was buckling under the pressure. Thankfully, the figures are now going in the right direction, but as we look ahead to winter, it's a chastening reminder that systems must be built and staffed to withstand whatever the virus throws at them. Like others, I also pay tribute to all those involved in the vaccine programme, but like Patrick Harvie, I'm concerned that the government is still humming and hawing about domestic vaccine passports, a full 9 months after we first pressed them for a decision. Last week, John Swinney said it would be the wrong way to handle it. Now there will be an app for our phones paving the way for vaccine passports by stealth. So why, given what the First Minister's just said, won't the government rule out domestic vaccine passports?
First Minister.
We're not planning anything by stealth. I've stood here today in front of Parliament and been frank about the options that we are leaving open, and given an undertaking to Parliament that will be full and upfront and consult Parliament in any decision. So, I'm sorry, that is not doing something by stealth. It's actually quite the opposite of that. Before I come back to vaccine passports, because, it is important, and I, as I said to Patrick Harvie, and as I've said before, I am far from convinced that they are the right thing to do, but I'll explain in a moment why we're not simply ruling them out for every possibility at this stage. But before I do that, there was a first part of the question about test and protect. Test and protect, as it will always do when cases are surging, came under pressure in July. It did not buckle under that pressure. It adapted and coped with that pressure and is performing well. And I want to thank everybody in Test and Protect. The work they have done has played a part in getting us to the point, from the point where we did have some of the highest case rates, or even at one point the highest case rate in Europe, to a point where we've got a much lower case rate, and we're certainly there or thereabouts. I think Wales might still just be below us, but we've got the second lowest, maybe heading towards the lowest case rate in the UK. These trends come and go, and it's what you do to try to stop cases surging, but when they do surge, to get them under control that matters. And people working across our public health teams have done an excellent job in the last few weeks to get us into the much stronger position we are in today, as indeed has the public. Finally, Presiding Officer, why don't I just rule out vaccine passports? I won't repeat everything I've said about my scepticism and healthy degree of caution about them, because people have heard me say it. But if there's one thing I have learned, and I like to think I've learned more than one thing over these past grim, challenging, difficult 18 months for everybody, is that in the face of an infectious virus that keeps learning to run faster than us, that keeps changing itself to make the challenge ever more difficult, after 18 months of having to ask people to live their lives in the most restricted and unnatural manner imaginable, I don't think it's sensible just to rule things out for ideological or other reasons. I think you've got a duty, and I've got a duty, to properly consider every possible step we could take to get our lives back to normal and to keep them normal while protecting people from the virus. Does that mean we will do every possible step, take every possible step? No, there will be things that we do decide are not right to do, and vaccine passports in total or in part may be one of those. But I don't think it's responsible, in the face of everything we've lived through and in the face of what we're still having to deal with, to just blithely, as a politician, rule these things out. So I will continue to keep an open mind to anything that keeps this country safe while also allowing it to get back to normal.